abortion. It doesn't happen then. Is labor induced sometimes at a very, very early age of gestation? Yes. And that's generally speaking to protect the mother's well-being. The second point I would reiterate is what the carrier pointed out. Paying for abortion is not new in this state. We've been doing it for almost 4 decades. This is nothing new. And I would venture to say that every single one of us could find something in the state budget that our taxes pay for that we don't like and that we wish our money didn't go for. But we don't get to make that choice when we pay our taxes. We don't choose where it gets to go. I want to also clarify about the cost-sharing issue. The Affordable Care Act already says that contraception has to be without cost-sharing. But if women's insurance doesn't cover contraception, or if they don't have insurance, that's a totally different matter. Then we deal with the expense. And every unplanned pregnancy that comes about because of inadequate access to contraception is more likely to lead to the elective termination of a pregnancy. I don't know anybody who wants that to happen. I think everybody wants to prevent unplanned pregnancies. I want to clarify, there's been a very good description, the carrier explained very clearly about religious exemptions. But I do want to make it clear that non-religious entities that simply happen to be owned or directed by religious people are not exempted, and nor do I believe they should be. When religious people own businesses, they have to follow Oregon law unless the sole purpose of the business is to, as the carrier said, inculcate the religious values of that, and the vast majority of the employees and the people they serve are of the same faith structure. I believe in the fundamental value that all Oregonians have religious liberty. But religious freedom shouldn't give employers the right to impose their religious beliefs on their employees by dictating whether or not those employees have access to reproductive health. I want to point out that abortion rates are dropping steadily across the country as more and more women have access to contraception, which we've done a great job of in this state with pharmacist prescribing, with improved access, with Medicaid expansion. Our abortion rates are going down, which is as it should be. I want to point out that when women get to choose when they have a child, they are more likely to be economically self-sufficient. They complete their education. They can take care of that child. There's a lower risk of child abuse when a pregnancy is planned. There's a lower risk of domestic violence when a pregnancy is planned. Domestic violence goes up during pregnancy. A shocking, horrifying thought. But when it's an unplanned pregnancy, that risk accelerates. Contraception, even when used properly, is not infallible. 50% of pregnancies in this country are unplanned, regardless of age or socioeconomic status. 50%. I'm sure every single one of us knows somebody who's well-educated and has a good job who had an unplanned pregnancy. And it happens. And if women, even those without good health insurance, don't have coverage for abortion, they may be put in an untenable, potentially highly damaging situation. I want to close by saying something really important. I don't want to argue about when life begins. And I don't want to argue that says women should have abortions. But I do want to point out that the mother's life can be at stake here. As most of you know, I'm a person of very deep faith myself. But my faith tradition has a different approach to saving lives. My faith tradition makes it very clear that the mother's life takes precedence. And the teachings of my faith guide my words and actions every single day. Furthermore, the definition of what qualifies as protecting the life of a mother is pretty broad. It can include the threat of serious physical or mental or economic harm. The decision about whether a mother's well-being is at risk is between her, her doctor, and other trusted loved ones and advisors. It is not within the power of the government to make that decision. Colleagues, 95% of the funding in this bill goes to cancer prevention, contraception, maternity care, and postpartum care. And when we do all of those things right, our abortion rate will continue to drop, and the needs for those services will continue to drop. So I urge you to focus on the 95% of this funding that goes for services that will ensure that every baby born in Oregon is born as a planned, loved, healthy as possible baby, because the mother got good prenatal care, good preconception care. She was as healthy as possible before she conceived that baby. And those babies have the best chance at life that they can. It's a health care bill. Cancer prevention is health care, contraception is health care, abortion is health care, maternity care is health care. This is a health care bill. Thank you.
Question arises.